I'm representing ORCHA, which is the Organization for Care and Health Applications. And really what we need to understand is we like to invest in health. Approximately 120 billion goes into our nation's health. But despite all that, we are facing significant problems. 550,000 people alone are diagnosed with diabetes. 16 million people are suffering with a mental health condition. And 68% of all adults in the UK are defined as obese. And that's, if we continue down this route, that's going to be a significant problem for the future generations to come. Now let's take John Lennon's "Imagine if all the people" phrase and look at a situation where individuals had access to 3,000 products just specifically to physical obesity, 12,000 apps looking at mental health. And let's say if all those products were just a fingertips away. Well, we already have that. Our apps on our phones are readily available and can be accessed within the blink of the eye. So right now there's around 300,000 apps available on the Apple and Google Play Store and approximately 4 million downloads a day. And approximately 93% of clinicians, including myself, believe that apps do have an integral role in how we manage health. And we believe that it can actually improve patients' health as well. So what are the problems? Well, how do you find the best app, considering you can pay approximately $5 to buy favorable app reviews? Can you really utilize the app reviews on Apple Store and Google Play Store to find which is the best app? How do you know what an app is trusted? What do you guys know what happens to the data that you provide to these apps? Is it shared? And how do you find out? And how can you integrate it within already quite established structure, things such as EMIS being one example? And that's why Liz founded the Organization for the Health and Care App Review. And what we do is develop personalized bespoke platforms, as you can see behind me, where we provide opportunities for the user to find the best apps in the best domains. For example, on the slide behind me, weight loss app, asthma apps, diabetes apps. And we've done this across multiple partners, as you can see behind me, Salford Royal. And here's just a comprehensive overview of the partners we've had to date. And what we'd like today to discuss with you guys is how can we encourage others to become champions of ORCHA, develop a type of community that provides and advocates the use of the best apps available, introduce us to other service providers that may need to get their app reviewed, and we work quite well with NHS Digital, and share the learning opportunities we found whilst reviewing apps and how we can optimize the apps available on the market today. So thank you for listening. More than happy to answer any questions later on.